You're listening to the Primary Care PT podcast. I'm your host, Dr. Katie Obright, and we're going to talk all things primary care PT. Stay tuned and subscribe. Hey everybody, this is Dr. Obright here. I just wanted to put a note in advance of you listening to this podcast because, we definitely talk about some pretty heavy, very real things in this show. And it was particularly difficult and interesting for me as a friend of Alexa, who is the person who's sharing her story on this podcast. Um, and I just wanted to, kind of provide almost a little trigger warning to anybody who has been affected by, maybe perhaps a not so great maternal health outcome. We do talk about some pretty heavy stuff in this podcast. I think it's extremely important for everybody to listen to, but I also want to respect uh, individuals who are out there who may find this a little bit more challenging to listen to. So stay tuned. Excellent episode. Really good topic. Dr. Seagraves is incredibly inspiring to me and to so many. And I just want to say thank you so much to my friend Alexa for having the courage and the bravery to come on and share her story publicly to help others. Okay, hi everybody. I have apologized in the two other podcast recordings that I've done today that I have been really inconsistent with my podcast. The thing on Apple Podcast says bi-weekly podcast. This one is more like 5 weeks in a row and then take a month off. And so yeah, guys, like it happens when it happens and you listen when it comes out. So thank you for listening and sticking with me, even though I'm super inconsistent. But this episode right now is, I had two other recordings today. The first one was awesome. The second one was great. This one is going to be fire. And because we're going to be talking about like some heavy topics, but also some really good hope for the future for our peripartum and women's community and family community. So I want to introduce our two guests today. I have Dr. Rebeca Seagraves, who is one of the most inspirational PTs out there, at least in the past year or so since I've gotten to know her on social media. Every time I think about you, Rebecca, I just I feel the fire. Like I feel the fire, I feel uplifted, and I feel like our missions are just sort of moving together. And then I have my very dear friend, Alexa Pasco, who our husbands went to Carnegie Mellon's MBA program together. So that's how we met back in 2019, and we survived the pandemic in Pittsburgh together. We were really each other's bubble with one other couple family. So today we're going to be talking about Alexa's journey. She had has a 4 month old, which this was her third baby. And sweet little Quinn is wonderful. And she was saying she's the best baby. You can say more about her in a minute. But had some early postpartum complications that were a little tricky. And then we have Dr. Seagraves, who has never really heard this story before and who can provide her feedback and her take on how potentially that could have been optimized by what she's doing, which is training acute care PTs and OTs how to work with and educate and evaluate women who've just had babies in the hospital before they get discharged. So thank you so much both for coming on. I think we'll start. Rebecca, do you want to introduce yourself or just say a little bit about what you do, and then Alexa can do the same?
Yeah, absolutely. No, I'm honored to be here. And Alexa, just even before you share your story, I'm honored that you're choosing to share your story and just even give an opportunity for listeners to just even problem solve, like how that could be avoided for other people. So that just takes courage and it's incredibly inspiring. And I just have to be honest, like, yes, I'm a physical therapist, but I've been constantly inspired by people in my community who do what you're doing. And that's really what kind of prompted me to focus on including a population that's not normally included. I don't say I do anything differently than any other physical therapist. Our discipline is just meant to help people function and improve their lives. And that's just what I'm doing for women who choose to give birth in the hospital. Not all do. Some of them are doing home births. Some of them are doing birthing center births, but about 98% of the population is choosing to give birth in the hospital. And I've just decided to just devote a lot of my energy to making sure they're getting the services that they need before they go home. And so that's a little bit about me. So thank you.
Well, so my name is Alexa. I am a mother to three. Little Quinn is 4 months. I have a 3-year-old daughter, Layla, and a 7-year-old son, Jason. I am a first grade teacher by trade.
Awesome. So Alexa, if you want to just go in and, just like I'll reiterate what Rebecca said about it taking a lot of courage to just share your story. And I really appreciate you doing that. So please feel free to share as much or as little as you want about what happened after you had Quinn. And you can kind of start from the beginning. You can just tell your story.
Sure. It is a little traumatizing, to be honest.
Absolutely. And we recognize that. And if there is anything that you don't want to share, that is perfectly fine.
Sure. And then also feel free to jump in at any time. But pretty much all 3 of my pregnancies were pretty difficult. Quinn's especially. The whole first 5 weeks was constant nausea and vomiting the entire first 5 weeks. Then at 9 weeks, I had appendicitis, which they decided to treat with antibiotics instead of surgery, which then a few months later, I had cholestasis for the 3rd time. And the pelvic pain that Katie helped me through was very grateful for her help. And then because of all of that, I was induced at 37 weeks.
I'm gonna stop you for 2 seconds. So for those of you that don't know what cholestasis is, so cholestasis is a condition, and Rebecca you could probably just say it way better than I can. It's a condition that affects the liver and liver enzymes, to my knowledge, where they become almost like overactive, or the liver doesn't clear them properly, or something to that effect, and it causes havoc. Like when I say it's one of probably the worst mid-pregnancy conditions that I've ever heard of or heard people experiencing, it's terrible. Like you're totally downplaying it a lot. Like it's horrible. It's profound itching and discomfort, and the list goes on with that, and it is quite high risk, which is why they induce early. And the pelvic pain that she's talking about, Alexa, toward the end of her pregnancy, we all got together at a lake house, got back together, had a little Tepper MBA program reunion, and she was having basically some symphysis diastasis issues. And I'll just kind of leave it at that. Rebecca, is there anything else? What did I miss about cholestasis, or
You're absolutely right. I call the liver like the second heart. So it's like anything that's affecting that organ, like it's systemic. It's around the whole body. Like it's just not one thing. It's all systems involved. And continue with your story. I'm so sorry you went through that, but I'm all ears for what happened.
It was a good time. I was very happy for the induction. So everything went well. I went in on August 7th at night. They placed the balloon, Pitocin, epidural, all those things. I had a successful VBAC with my second child, so I chose to do it again with Quinn. And everything went beautifully. It was the easiest birth that I have had. Everything went smoothly. I had one mildly elevated blood pressure during the birth. I am understandably, I think. And then I believe my husband said 6 pushes, she was out. Everything was great. And the few hours after that was also really great. I was very thankful for that because my previous 2 were awful. So after that, so that night was great. The next day was great as well. Everything was normal. I even wrote down my blood pressure. So day 1 after 105/66, day 2, 111/67. Everything was great. So I was discharged after 2 days, and everything seemed fine. It was great. We came home with baby. It was awesome. I had my mom and my mother-in-law here to help, so we had 3 other adults to help with the kids. Um, and everything was normal. Then I started to feel a couple things, but everything was semi justifiable, which is why I think we all missed these signs. My feet were slightly swollen, slightly, nothing crazy. I was super tired, just had a baby. I had a headache, but I have headaches all the time, so they're not new. And then I had neck pain. That was the only thing that was odd. It was like pressure in my neck. But we talked about it and we decided that it was from holding the baby like this.
Okay, and just because most people are going to be listening to this, when you were pointing to your neck, when you say neck pain, you were kind of pointing to the front of your neck, which is a little unusual. Is that where you were feeling the pain in the front?
Yep, the front all the way
Mhm.
to the side. Nothing
Yeah.
in the back.
Mm-hmm.
Just
And yep, and that again, like justifiable to you, but to me, when I see you do that, or I see a patient sort of say that they have neck pain in the front, the very first thing that comes to my mind is cardiac and vascular, because if it was musculoskeletal, typically the pain patterns are going to be in the back, maybe on the side, maybe going down, on the inside aspect of the shoulder blade, but the front is, as soon as you went like that, I was like, oh, that's it, so but interesting. Okay, go on, sorry to interrupt.
um that went on for 2 days, I believe. 3 days, I believe it was, because it was Friday, Saturday, Sunday. And the neck pain was what was getting worse. As well as like anytime I went up the steps, which I know I shouldn't have, but mom of 3, you got to do what you had to do, right?
Mhm.
By the time I hit mid step, I was out of breath. So I was just so tired. And then my sister texted me to check in. She is a nurse down in North Carolina at Duke. And she just said, hey, send me your vitals, just so I can check in on you. And I did. I sent her a picture. I have a blood pressure monitor here. And she called me immediately. And that's when I said, uh-oh, something's wrong. So the first picture that I sent her was 140/80, and my pulse was 47. So she called me after that photo and demanded that I do it again. So I actually have 2 separate monitors. So I used the other one just in case that one was not working properly. And the second one was 149/80 with 46 pulse. And she said that I needed to call the doctor to see what they suggest. So when I called them, they asked me to do the blood pressure again one more time, and now it was at 160/124. So they said, "Come on in. We need to do an in-person eval on you," and that's what we did.
Rebecca, do you want to go, or
I'm like holding my breath while you're saying all of this.
same?
Um, I guess I have more like questions than anything. They've asked you to come into the office, but not go to the hospital at this point. Is that right?
I went back to labor and delivery.
Okay.
That's where they
Okay.
sent me.
Okay. I'm thinking a lot of things, but we had an OBED. And so I always caution myself to just start talking about the obstetric emergency department, because not every area I've lived in around the country, and I've lived in all time zones, has an OB dedicated emergency department. That's kind of where moms are provided with the best care, because that team is like ready to go, whereas there would be more of a delay. And I'm already thinking there should have never been a delay at all, right? You were already having signs and symptoms of some type of cardiac issue. But that's just kind of what I'm like, the alarm bells are going off in my head right now.
They asked me to come back to labor and delivery, and they put me in a room. Triage maybe is what it's called.
Probably, yeah.
Yeah.
So they put me there for an hour or so, and I do know that after the nurse there took my blood pressure again, it was 159/88 with the 47 pulse, so it's in the 40s. They did call the emergency room to see if they would like me to go down there, and they decided that I would stay up in labor and delivery, with a cardiologist coming to visit me personally. So that's what they decided to do. I was then admitted for postpartum preeclampsia and acute heart failure is what they labeled it.
Wow.
I have something else. I don't know what this is, but my sister found it significant. My BNP level.
That's
Mhm.
correct.
Oh,
Yes.
705, which
Right.
is
So normal would be under 400.
yeah.
Right. And so truly, like, signs of congestive heart failure or heart failure is when you start seeing BNP over 400.
Mhm.
And so you were already in the 700s when you arrived at the hospital. Yeah. And that's a lab value that we try to get a lot of acute care therapists to look at, if that's something that was drawn in the labs before moms are going home, just to see if there's actually any issue before they even go home. So I'm glad that you actually had those results to show your team. Um,
So many things. I first of all, like it's this is the first time, because I know we texted about this and talked a little bit about it just after it happened, and I just was mind blown then. But this is kind of the first time that I'm hearing you tell this story, and like as your friend, I'm just like it's almost it's way more impactful to hear this coming from like a friend or a family member. I love all my patients, don't get me wrong, but like coming from it's man, it's like really tough to hear, because this is really scary stuff. It's really, really, really scary stuff. And so I guess my questions, and this is kind of for you and for Rebecca. My question would be, when they discharge you from the hospital, or like in the time that you spent in the hospital when it was wonderful and you just had your baby and it was great, did they give you any sort of like safety netting guidance, like, hey, these are the things that you should probably look for, or think about? And I don't necessarily know how Rebecca, you can speak to this just so much better than I can, about is it common enough to talk about what probably that neck pain that you were experiencing was like venous, like jugular distension, I'm thinking, maybe some referred cardiac, like lots of different things. But is that common enough to educate on, like, hey, if you're having neck pain that it kind of is like in this area, that's something to consider? I don't know. Y'all tell me. I don't know.
yeah. Well, so there was a lot there. Alexa, if you're okay with me just actually just kind of like also educating the listeners about signs and symptoms of preeclampsia, signs and symptoms of something wrong with the heart, right? First, but I'm actually really curious, as much as Katie, to know what education you were given. But for people who don't know about preeclampsia, pre really throws people off because they think it's during pregnancy before birth. But preeclampsia can extend into the first 6 weeks after someone gives birth, right? And so with preeclampsia, the cardinal signs of it, swelling in the feet or hands, is upper, usually right shoulder pain or upper epigastric pain. So just above the stomach, right in the area of the liver, right? And then also swelling in the face, and then high blood pressure and protein in the urine. And so those are the kind of the cardinal signs and symptoms, if you will, of preeclampsia. But then one of the probably most harmful symptom is nothing at all. And so once it gets into this pain in the front of your neck, that's when we think cardiac issues. Because for women, they present a lot differently than what we've kind of known for years on end as men presenting with heart attack or heart failure or heart symptoms, is that left upper quadrant pain down to the hand and the left arm. What women may present as is actually this jaw, almost as if someone is basically doing a choking sign, right? It almost feels like you are being squeezed here. And then you have pain sometimes in the back between your shoulder blades or right above your breastbone. And so those are kind of the cardinal signs and symptoms of cardiac issues in females. But then along with the signs and symptoms you were already exhibiting with preeclampsia, those two together is just a storm that, for me as an acute care therapist, I would have not just wanted to sit down and educate you, but because you had stairs at home and maybe also you had a induction, right? Because of a very, I would say you had a miserable pregnancy with cholestasis, right? With what you were describing to us before, I would say was actually even more important. Even if you weren't classified as high risk pregnancy, you still had a pregnancy that had concerns. That instead of just sitting down and educating you about signs and symptoms, I would have actually wanted to see, how do you respond to actually going up and down stairs before you even go home? And are we able to pick up there's a rise in blood pressure, there's a rise in heart rate, or there's a drop in heart rate? There's something weird going on, because now that you're in that environment, you're really truly on your own. You're outside of the medical system. And so I don't know if that's something that was done, that they were actively monitoring your vital signs with activity.
No, it wasn't. A few of the things that they went over, along with giving me the discharge instructions and like a folder, was just call if or come back for excessive bleeding, severe headache, pain in my lower stomach area, all those typical fever kind of thing. But nothing about the neck. I do think they said chest pain, but I didn't have chest pain. It was all in my neck area, and I'm on baby number 3. I've never heard of neck pain, to look out for neck pain. It was definitely something new, and something that I will let any of my pregnant friends know to look out for.
When they were educating you during your whole postpartum stay, or even antepartum stay, from the time that you were induced, were they measuring your vital signs? Were they taking your blood pressure and heart rate? Was it only at rest, or would it be after you had gotten up and moved around and then they took it immediately after?
I do not recall having it taken with movement during that initial like post-birth stay. They did when I returned with the postpartum preeclampsia and acute heart failure. Then they did resting and with activity, but I believe it was always just laying down in bed.
I guess the reason why I probably educate people on that the most is because people's environment varies so much. You're a mom of 3. And I didn't actually catch, and maybe I missed this, how old your other little ones were. But the literal, the younger they are, probably the more active you have to be, right? If they're older, they're able to kind of self-soothe or be engaged in other activities or let you rest. At least you have the newborn as well. But that's kind of a big question that even just for educational purposes, this is why we ask each individual questions about the environment they're returning home to, which is what we coin as social determinants of health for like healthcare providers that are listening to this. And we don't categorize a whole population on whether or not they need OT or PT services. Like we do it individual because every journey is very individualized. And you had three little ones that you also had three adults in the home to help you with. But the impact on your body, it would have been better to assess you in all of the movements of life that you would be engaging in and not just at rest, right?
Yes.
And
And
I'll just I'll just reiterate that your experience is not uncommon. In fact, I think it's actually more uncommon and hopefully getting better because Rebecca's smashing life. But it's not uncommon. It's actually way more common than not to just have your vitals taken at rest. But there's just some significant problems with that because of all of the reasons that Rebecca just mentioned. Sorry, I interrupted you. Go ahead.
I was just going to add that my kids are 3 and 7, and even though I did have three other adults, I'm still mom and they
Right.
want mom. And I would assume that a lot of other moms are like that too. Um, their babies still want them, and it's hard to not coddle them and love on them even when you can't.
Yeah, especially when you're just kind of supposed to just bounce back, right? Like, and even after I had my kids, like I just wanted to bounce back. I wanted to just be up and active and I wanted to do everything that I wanted to do. So just taking the rest that we probably should be taking, uh at least I was my own enemy, but sometimes in other circumstances like women just have to do what they have to do. And if nobody tells you about specific things to look for, then how do you know? I mean, everything that you just mentioned, all of the symptoms were totally justified. And again, neck pain, if you're somebody who is just an average person, even if you are in the medical profession, I think that there are certain professionals that would know that anterior neck pain in the front of the neck and maybe the side of the neck, like where the collarbone is, there's not that many people who would differentiate you because as a patient you're saying, oh well, my neck kind of hurts, and that can be like, oh well, did you sleep funny, did you do this and that? But if you're not actually asking the question about where the neck pain is, you wouldn't necessarily know to think of this as, oh, that's a cardiac referral pattern for most women. Even up into like I pulled up that there was a paper that I reviewed as part of my primary care course. And I'm just going to share my screen for a second. And for those that are actually listening, I will link to this picture. But it was from a paper and it looked at, the biggest cardiac referral pattern is obviously right in the chest. That's why they say that. If you're having like a heart attack or some type of cardiac issue, you'll have some pain in the chest, but it can also refer down the side of the left arm up to the left shoulder. But see all of these other little red areas? This was a symptom map that this paper produced based on the experience of like thousands of different people about where they felt their cardiac symptoms, and a lot of them were like in this front of the neck area, in the throat, even some people were mentioning like a toothache. So I think it takes a really good professional um to educate on those types of patterns. I don't know. So Rebecca, like what do you think here? Like,
I'm so again, Alexa, you had that, like you actually were able to reach out to someone and it was a nurse in your family. I just want to make sure.
Yes, my little sister.
Well, but
Mhm.
she
Your
reached out
little,
to you. She was the
Very
one
true.
who, because I'm the thing that I go to, especially as your friend, as like I go to like, well, what if your sister wasn't a nurse and didn't reach out and ask you to take your
yeah,
vitals?
You know, I tell her all the time she saved my life.
Seriously. Okay,
Alexa,
go.
she
Sorry, go
did.
ahead. I'll stop.
No, I'm almost like I'm on the edge of my seat, and I feel like Katie has a flow for a reason, but I'm almost like wondering, you were diagnosed with acute heart failure. Did that resolve?
It has since resolved. Yes. I
Oh,
actually just had my
okay.
final follow-up on the 1st, and everything looks
Okay. And I asked that because I'm just like this huge, just like overwhelming joy, just to hear that. But you're sharing your story so that also listeners can understand that those individuals who don't have anyone in their support system reaching out to them, they're going on to experience chronic heart failure, which is called peripartum cardiomyopathy, or congestive heart failure that happens within the first 12 months after birth. So, up to a year during the postpartum recovery, that chronic heart failure, that heart failure that doesn't reverse, is coined under that. And it makes me just think, how do we put someone in a support system where, we don't have a nurse in the family reaching out to us? How are we able to educate moms earlier? And I can't think of right now any better place than the hospital and the home during the first 6 weeks. What would you say to that? Because a lot of the pushback I do get, and the therapists I train, are that it would be overwhelming for moms to be taught about checking their vital signs or checking in with their symptoms in a very kind of hands-on way. And so let me just clarify what I'm saying there. You were given education at rest. Your vital signs were taken at rest. You were most likely sitting down and being handed probably a packet of information, maybe, about the signs and symptoms to look out for. Whereas in my profession, we're more hands-on. We're actually maybe taking you through, either walking around the hallway on the birthing unit while checking your vital signs, negotiating stairs if that's something that you have to return to at home, and maybe even simulating or actually doing, um, a walk with your baby in your arms, because generally you'll be moving from room to room carrying your child. And we're doing that as early as the hospital stay, because that's day one for you when you're at home. That's what you'll be doing. You'll be carrying your baby and walking room to room. And so the pushback that we'll receive is, that's too excessive. Moms are way too overwhelmed. They just had a baby. Let's not do that. But then our argument is, well, who does do that? Because you were fine. You had two other adults in the home. There was not going to be a nurse to come home to see you. And there's definitely not an OT or PT that's needed because you're fine. So when else do we do it? And so I would just, I mean, for me to learn, I would love your thoughts just on that.
I don't know. Even if it is overwhelming, we need to be shown how to do these things and what to look for better. Um, because I was on my way up to take a nap when my sister called to check in, and or text to send her the vitals, and she doesn't think that that would have been very good at the where my levels were. I don't know. Moms, me include, I needed to know more. I needed to know more what to look out for. Even experienced moms, baby number 3, I had no idea that I was in that kind of state.
I it's interesting. So Rebecca, you're saying that you get pushback sometimes from therapists that think that this would be too overwhelming on like new moms or moms that have just given birth.
Katie, if you will believe it, Alexa, just excuse me for a minute. I'm going to just kind of like
Please blow up. Please blow up. That's all I want you to do.
Blow up a little bit. Believe it or not, the most pushback we're receiving now is from other rehab therapists in the hospital.
Doesn't surprise me one bit.
Well, it does surprise me. And so the term is new for me, walkie-talkie. I had actually never heard of it. I never heard that we had actually coined people in the hospital as walkie-talkies. That means that, Alexa, you can walk just around fine. You just had a baby, you're walking, and you're talking. And so in my profession, very select few of therapists, I would not categorize our whole discipline as that, because I think that that's kind of deplorable, is that they'll categorize people as walkie-talking, meaning they don't need our assistance. They're not a priority for us to educate and actually assess their vital signs with activity because they're doing fine. Let's prioritize the individuals who can't get out of bed and who aren't speaking to us. Let's get them back. If they had a stroke or a spinal cord injury, they're the priority. And I understand that history of triage, but then I'm looking at it in the context of our maternal health outcomes in this country. And I'm looking at how many moms are not there for their third child down the line. And so I can't tell you the fire I breathe when I hear that term now, because I realize that's a lot of the reason why we're actually missing women like you, is because you look fine, right? You look fine. And that's actually almost a blinder, because we're not going deeper than what we're seeing with our eyes. We're not trying to dig a little bit deeper and ask you more questions and just give you the courtesy and dignity of an evaluation. Given your history, I would say a difficult condition to have gone through during your pregnancy that led to a 37-week induction. The dignity of an evaluation by a rehab professional that could actually probably have caught signs and symptoms of an abnormal blood pressure while you were going upstairs would have probably saved you so much time on the back end.
Walkie-talkie, like I am going to lose it.
Please do.
I would actually lose my shit if a therapist told me that that was their reasoning for not wanting to do something that could significantly improve the outcomes and the quality of somebody's experience and their ability to identify something. I've said this before and I'll say it again. Like, I'm not often rendered speechless, but that's one of the things that I like. If somebody really wants to stick with that mentality, like, those are just not the people we ever need to engage with, because if they're going to be stuck in that, like, okay, just please retire. Like, just please retire, because you don't have the patient's best interest in your heart or in your mind or in your soul. And that's deplorable is a really good word for it. So
It is. And Alexa, for your knowledge, like, a lot of this, I think, will be history. Like, we'll look back and we'll say 2023, they weren't assessing or evaluating moms. Like, you just gave birth. Like, yes, it was a beautiful birth experience, everything that you described. But then the next step is just to kind of prepare you now for an environment where you're going to have 3 little ones who need your attention all equally, maybe at different times, but they need you. And so the next best step is to kind of elevate our care to match your environment, your journey, right? Your particular circumstance, your social determinant of health, whatever it is. And so we're waiting for people to retire who are still using that term. Unfortunately, they're still breeding. There's a bit of breeding in healthcare where they're passing on that kind of culture. But I think that the more that we see of a turnover in our profession, the more equitable care will be for moms who deliver. Because for me, the next barrier then comes to the physician and medical team, and you actually have more control over them than we do, right? So a lot of rehab therapists in the hospital, they need an order. They need an order from your doctor and your nurse. And so a lot of the barriers, if we're not calling people walkie-talkies and saying, well, we have more of a priority on another unit, we don't really need to go to the maternity unit to offer our services. Well, the next barrier would be, well, we don't get an order. We never get consulted there. But I would argue that the more we educate someone like you, who's already been documenting your blood pressure. You were already doing that even before your sister called you. You were already like documenting your blood pressure. Well, if you were to do that in the hospital, or at least be educated and informed that this is something you need to just do before you go home, when you're actually active and you were to catch something, you can educate the team. You can ask for a referral, and you can have a consult that you've dictated and you've advocated for. And that's really kind of where my focus is because I can only go so far with medical professionals and rehab therapists, but I can go unlimited, in terms of how much education and advocacy that you could do, so that you know that everyone has all eyes on your particular situation because it's unique to you. A mom of three, second story, maybe multi-level home, and support that you have for the babies, but yet care that you need for yourself. You can probably do more than any of us can.
That is very important to know. You have to advocate for yourself. And I didn't know PTs, it was available in the maternity realm pretty much. So that was kind of news to me today. And then Katie, I didn't know if you wanted to touch on the medication and everything for the postpartum preeclampsia.
Why don't you talk about that experience? Because that had its own little level of own little bundle of fun. Not really. It's a terrible joke.
So correct me if I'm wrong, the treatment, I guess, for postpartum preeclampsia is magnesium. Okay, so they had me on a magnesium drip. And that eventually, a few hours later, led to a syncopal episode that lasted, in their notes, it said it lasted 5 minutes. To me, I feel like that's a really long time to be out cold, I guess. Thoughts?
Yes, so many. Were you by any chance in bed the whole time that you were on the magnesium sulfate drip IV?
Yes, it
You were.
was. It was initially placed like towards nighttime and then overnight. I had it like overnight, and I believe the syncopal episodes was around 6:30, 6:45-ish.
Okay.
Mhm.
5 minutes is a terribly long time to lose consciousness, essentially. For those of our listeners who don't know what magnesium sulfate is, it's one of the contraindications to receiving at least any kind of rehabilitation or therapy out of bed. You're not getting up and walking if you're on IV mag sulfate, because it tends to drop your blood pressure and it causes orthostatic hypotension. So that's where you will be dizzy and you can pass out with this IV drug being administered. But to have a syncopal episode when you're resting, that is a new one for me.
And I pause you there. I'm so sorry. I was up and going to the restroom with the nurse.
No, that was a visceral response. Sorry. Your nurse was assisting you?
To the restroom. Mhm. And when I got to the restroom, I said, I don't feel so good.
No.
And then I fell onto her.
Oh, Alexa, I'm so sorry. That is negligence. And I have to just say this. I understand that this is being recorded in public. I say that truly because we actually, for my course, I teach acute care OTs and PTs how to provide their services to this population. And we have in our certification course a case of a woman who also, her nurse got her out of bed on IV mag sulfate. So she's still hooked to the IV pole, right? Or maybe she disconnected the line, but she still has that drug being administered to her. And she still had kind of the remnants of the epidural. So this is immediate postpartum. She had not gone back home and then been brought back in like you did. And while she was sitting, because she didn't have that kind of muscle control still, the epidural was still numbing. The exposed pipeline behind the toilet in the hospital was to her back as she was lowering herself down to the toilet seat. And the nurse was really not helping as much as she could. So she lost control and fell and hit her part of the back against that exposed metal pipeline and completely lost sensation. So she was paralyzed for about a little over a week and a half, had to go to inpatient rehab, whole advocacy effort there. But again, the time of that, the things that could have happened in your case that didn't, thank goodness. But it's a rule of thumb, and I call it negligence for a reason, is because anyone who's on mag sulfate is on a drug that is actively lowering your blood pressure. So it's lowering your body's ability to get blood to your brain and to just function. And so syncope is one of the number one in orthostatic hypotension, that kind of like driving down effect of your blood pressure when you're moving from sitting to stand. That is a number one like contraindication or sign to look out for, because it's a contraindication for us to get you up and moving. You shouldn't be walking, shouldn't be going to the bathroom when you're having that drug administered to you. It's something that's done after the fact. And so that's why I'm thankful that you didn't have anything worse happen, but for 5 minutes, your body took that long to recover.
It was a tough couple minutes there, and they did not restart the magnesium after that. Once they got me back into the bed, they took my vitals and they checked the magnesium level. My blood pressure was 88/56, so pretty low. And the magnesium level was 8.1.
Katie, do you see why I think my soapbox, if I had to have one, and I hate that I even call it a soapbox because to me it's just common sense at this point, but if people need to give me a soapbox, it's taking vital signs before you're getting someone out of bed, especially on a blood pressure lowering medication, or if they've lost blood after delivery, during delivery, if they've given birth, if they are postpartum for 6 weeks. It's just taking blood pressure before activity and after activity. And I think what happened was they disconnected your IV and just got you out of bed to go to the bathroom. I don't even think that your vital signs were checked. Were they, Alexa?
I don't recall.
Yeah.
I don't think so, but I don't recall either.
But when they checked them after you had been in bed and rested, you were still 88/56. Is that right?
Mm-hmm. Now, the normal for magnesium level is in the 3s, I believe.
It's, at least that's, oh, well, you're talking about dosage. Okay. What were you? Like, I'm ready to ask. I'm sorry.
Mine was 8.1.
Oh,
And I believe your normal level is supposed to be in the 3 range.
okay.
A little lower.
Oh, okay. So it was far past normal.
And I don't know, because I've never worked in acute care, so I'm not as privy to like, you know, these tests that can be done sort of quick and that kind of thing. But I that's high. So, but if they're giving you a magnesium drip, like they want it to be, they want to like kind of high dose you, right? Or no? Yeah, I don't know. You tell me, Rebecca. I don't know.
I mean, generally, if your blood pressure was extremely high, right? And so the whole point of magnesium drip is they're protecting your nervous system, your brain, right? They're trying to prevent a stroke, right? You were coming in with stroke level for postpartum, right? Anything over 140 over 90, getting into 160 over 90, severe hypertension. So they were really just trying to do the best that they could to bring you down. They just overshot, right? It also depends on the person. Like to dose, you really have to be quite accurate with it's going to get more medical, but fat content in the body, adipose tissue, all of these things, how well your blood is circulating. If you're young, healthy, maybe you don't need that much that someone else would need who's coming in with those high range blood pressures, who might be a different body type or whatever it is.
Well, and
And
Alexa's
so
pretty small. Like
I'm looking
five,
right
what
at
are you,
you. And so I'm
five,
just,
5 foot, 5'1"?
I
Like,
oh, wow. Wow. You're 5'1". And again, like for listeners, education wise, as a rehab therapist, you might not be involved at this point in terms of like where the dosing is and all of that, but the education to nursing on activity, getting someone up who's having probably more than they need to lower their blood pressure of magnesium sulfate is still a contraindication of getting that person out of bed, especially when their risk for orthostatic hypotension, syncope, passing out is so high. And so they overshot.
overshot with, and then got you up. And
Negligence.
and it's that by definition that's negligence. It's just doing something without even being aware of the
Yeah.
consequences. Yeah. I'm again rendered speechless. I
I'm a
just
little speechless with that too. I don't that has me for a loop. And I'm hearing these stories, like we have cases. That's kind of what our course is built on. For acute care therapists, they just need to be immersed in people's stories. 'Cause that's really how we learn in acute care. I mean, we can have a particular patient population that we're comfortable with, but we're supposed to be able to treat anyone who walks through the door. And so in your case, it wouldn't scare me to treat you. It would just be, okay, here's what I would expect. But the fact that we're hearing that nurses are getting people up on that kind of drug, or they're sending people home without doing vital signs, this is more now getting into a public health service that we're doing, that we need to make a public health announcement, so that people are just aware of how to protect themselves and not depend so heavily on the care team, because they're missing quite basic information at this point. And you wouldn't have known. It probably would have been helpful for you to know what the side effects of the drug were. So you could say, maybe it's not a good idea. I know I need to go to the bathroom, but do you have a bedside commode? Best thing you can do for someone on magnesium sulfate is to keep them low, not high, right? Because their blood pressure is being brought down low. So you want to keep them in terms of their relation to gravity, if you will, low. So you scooting over to a bedside commode is safe for your system to handle. It's not too much demand on your heart and your system to try to get that blood to your brain. And so a bedside commode for anyone who's listening is what should be offered if you're on magnesium sulfate. So you're still dignified. You're not having to have a bedpan under you or anything like that. You should be able to still sit, but not stand. And for acute care therapists who are working with this population on IV magnesium sulfate, we teach you that you can do anything in sitting. You can still have them kick out their legs, be functional. For moms after C-section, you can practice log rolling, getting out of the bed with an abdominal binder. For anyone who's had a tear, anyone who's lost any blood, getting up to the edge of the bed and sitting is safe. Standing and walking, not safe at all. they can out on you because their heart doesn't have enough oomph, if you will, to get the blood fast enough to the brain. That's called exertional hypotension. Orthostatic is just moving from sitting to standing, but walking and your blood pressure dropping is exertional hypotension. That is a hard line no. And nurses should be educated about that as well.
So I have some thoughts here, and I think that, just in the interest of time, that there's a couple of things that we can do to wrap this up and make sure that our listeners, and that, um also Alexa, like, you and anybody that can sort of be aware. But um Rebecca, what do you think? What are some things that, if you were with Alexa and she has, beautiful Quinn, and she's doing really well, first, day 1, day 2 in the hospital after birth, what are some things that you're educating her on for when she goes home? Well, we already know that have already done, let's just assume that you have already done your assessment, where that Alexa has stairs at home. So you're already doing, you're assessing resting vitals, you're assessing vitals in sitting at the edge of the bed, and then getting up, uh walking around, as long as she's feeling good with that, going up and down stairs, if she has stairs that she's returning to at home. You've already done all of that. And let's say they were all super great, which I kind of have reason to believe they would not have been super great in your circumstance if those were done. However, let's just assume those were all great. What are some education components that you would give to her for preeclampsia, but just kind of for anybody in general? What are some things to look out for, that safety netting guidance?
To give that same assessment to yourself when you're at home. So if you had anyone in the room with you, Alexa, at the time, say before maybe extra people arrived to care for the other children, if there was someone though in the room, I would say your journal will have 2 columns. One will be at rest, just kind of the blood pressure you're taking every day at the same time because you were doing that. But then the other would be in response to something that was a little bit more demanding, right? And that could have been going up and down stairs. Maybe that was kind of the most demanding. If you were ever holding your baby while doing that, that would have been really demanding as well. For some people, taking a hot shower and standing, for any amount of time is also demanding. And so if there's a way for you to have that second column of your response to activity, that's what I would have went after, because I can't really do that in the hospital if I'm only seeing you that one time for 1 hour. But you or someone in the room could just be monitoring you for the next few days. And that really is for anyone who gives birth. I mean, that's probably something that you probably didn't have to worry about first and second baby. But I say, for kind of a lesson for just general public awareness, it's good practice to just monitor your symptoms over the first few weeks, and in particular, how you're responding to activity. Activity that's a little bit more demanding. 3 kids, that's demanding. You're not having a lot of sleep. Your body's not really able to kind of recover. So your body's going to respond a little bit differently. And if you're any sort of feeling fatigue, your body's working a lot more, having a lot more energy just to do activities that wouldn't have seemed very demanding, like going up and down stairs. So that would be really the next step there, is to have that second column of your response to activity. Third column, if I were to really not want to overwhelm you, it may be more for your caregiver to kind of take on as well. If you're kind of like, okay, I could just do that, but not much more, can't take any more information. That third column would have been where you list symptoms that you were having, anything at all. I don't care if it was pelvic pressure, if it was the throat pain, if it were just back pain that was coming on. You guys were thinking it was just breastfeeding position, chest feeding position, whatever it was. It would have been a third column where you just list out almost like a diary of what you're experiencing. And if that is something that's doable for people to be educated on and it's not overwhelming, I think we could probably catch a lot of these things a lot sooner. I don't know if you agree, Alexa, or not.
I agree. I think that would have been doable for me at least. And I think it would have helped me reach out to someone sooner than I did. I also wanted to point out when I went back to look at the things to look out for that I received from the hospital, one of the bullet points said anything that doesn't feel right. And I wanted to just emphasize that because I should have realized that's not right and I should reach out to someone. So, any other postpartum friends, if something's not feeling right, you should reach out to someone.
And that's okay. So, but on the same level, because I've been in this circumstance after I had Hunter, I had just, I wouldn't say I had significant hemorrhaging. I had some mild hemorrhaging, and I don't even know if I should call it hemorrhaging. I gave birth in a birth center with midwives. It was a great experience. And the thing that I loved about this practice is they came to my home to visit me within 24 hours, and then maybe like a couple of days later. I can't remember exactly, but they did come to my home to assess me afterwards. And I just want to remind you that yes, it's good to be an advocate for yourself, but in those circumstances when you've just given birth and you're so tired and you just came home and you want to stay home and you feel these things, but it's justifiable. What Rebeca is suggesting by just monitoring these things, having another person, a healthcare professional or a nurse or somebody who, okay, you came home. All right, 3 days later, somebody's going to call you. Or and if something is wrong before that, reach out to us. But we also can't rely on people to reach out with every little thing because of all the reasons I just mentioned. After I had Hunter and I had that little bit of hemorrhaging, I definitely, and I knew, because I definitely was having some orthostatic hypotension and exertional hypotension, and, probably pushed myself way too much. And I'm a healthcare professional and I knew it. But I just didn't want the bother. It was already so stressful. So my thought with this whole thing is like after, and Rebeca, maybe you have like a better system for this, but like after, a PT or whoever it is that's doing this education and doing this evaluation in the hospital, like there should be some sort of follow-up plan or, a portal or an app or just some checkpoint where someone can reach back out to you and be like, okay, where's your symptom list? Where's your vitals list? Let's go over this. Because I think there's like this critical window where you can almost justify to yourself just about anything that something's okay and it's wrong and you don't want to go back to the hospital. You don't want to seem like you're complaining. You don't want to do this or that, because I've been there. And so it shouldn't just, I just want to just make sure that you understand and that everybody else understands that like it shouldn't just be you who is, or the mom who's relied upon to report everything. That caregivers can be actively involved in this too. Like maybe if they were all educated at the same time, like what are your thoughts on that?
I think this podcast will create an app like that. I mean, I do. I mean, I think that apps like that already exist. There's all these alerts that we have for everything. And here's this whole population that it makes complete sense within 48 hours. Within 48 hours of leaving the hospital, absolutely. Let's call you. Let's alert and just say, hey, let's check in on this person. Right. I think in our lifetime, we're going to see that. And that's why I say this will be history, Alexa. Like your experience will be something historical that we'll look back on. We say, wow, we weren't checking in on moms. We weren't just calling them.
I mean, it really does blow my mind a little bit in 2023, but this year alone, there's been like New York Times has published 2 different articles this year on postpartum mortality and how in this country, like just how it is absurd. It's absurd compared to the global standard. It's just absurd. And I just, another thing that I've heard a lot, which I really need to cut myself off because I could keep going for a million years on this topic, but I've heard over and over and over again that like C-sections are just kind of no big deal, and like in our culture in the United States, it really sometimes is looked at like it's just this thing that you go in, you have it done, you have your baby, go home, it's great, everybody has it done, no big deal. And all that I think to myself, I'm like, but that's abdominal surgery. Like, that is an abdominal surgery. Like, I don't understand why that's being treated any different than, another abdominal surgery where because not only are they cutting open your abdomen, they're cutting open your uterus.
Yes.
And I just like, again, I really need to cut myself off because I could go for a long time, but like the culture around maternal health in this country needs massive overhaul. And I think that Dr. Seagraves is going to contribute in a huge way to that. And I want to help her do that. And Alexa, people like you sharing your story, everybody sharing their stories about these things is going to do that and accomplish that.
Alexa, your story, I think, is probably the catalyst for all of it. I mean, people are not going to listen to me, right? Not in the way that they'll listen to you. And you, to me, I think, hold the key to pushing along whatever it is. Is that the technology? Is that the culture? It's all of it. It really is. It's all of it around maternal health. We treat it so mundane, and it's not. It's a major change to your body.
Major, all systems. So I think anybody listening, and just to wrap this up, anybody listening, if you are about to have a baby, or you know somebody who's about to have a baby, or you're about to become a grandparent, or at any phase of this life, you're going to come across somebody who's going to have a baby, and it might be you, it might be someone else that just tell them to get an automated blood pressure cuff. They run anywhere between, I'm on Amazon right now looking, anywhere between $16.99 with a $5% coupon, all the way up to, you can spend, I don't know, 35. You can spend a lot if you really wanted to, but really, yeah, if you for $20, around $20, you can get an automated blood pressure cuff that also takes your heart rate. You just slide it on your arm, and as long as it's calibrated properly, which it should be, and the manufacturer has instructions, you press a button, it takes your blood pressure. You do that at rest. And then if you want to be cautious, you do that when you're, maybe sitting, especially if you're having some symptoms of dizziness or lightheadedness when you go from laying down to sitting. And then again, standing, especially again, if you're having some of these symptoms with a caregiver nearby. And then if all's well, then you can try to do a couple of things. Walk around the house a little bit, take your blood pressure again, record the response. And then same thing with stairs. And if all is good, then you can kind of gradually get better from there. But that alone, just doing that in and of itself can save a life. It can save your life. It can save somebody else's life. And that's just not something that people are doing. It's not something that they're educated about doing. But I think Dr. Seagraves is going to change that mentality.
I think we all will. Thank you, Alexa.
Yes. Oh my gosh. Thank you so much.
Share.
Is there anything else? Any first of all, Alexa, any closing thoughts, or anything else that you would want to share with anyone else who's kind of going through this experience? Anything you want to say to healthcare professionals?
Yeah.
Mm-hmm.
I do think that a 48-hour check-in should be mandatory. I think that would have saved me a lot of time. I also would like to say, for anyone who has someone postpartum in their lives, check in on them, and take what they say seriously. They've just been through a lot, and I know, at least for me, like Katie had said, you're trying not to be dramatic, you're trying not to complain, but some things need to be shared. And one more time, thank you to my sister Ashley for saving my life.
Absolutely. And then Dr. Seagraves, I'll ask you the same question. Anything that you want to wrap up with or close on, or plug yourself and your business and your courses and your cool things that you're doing.
Yeah, for me, 2024 and beyond is really going to be finding people like Alexa. I think that the next phase of my career is going to be really relying on the people who have the most up-to-date evidence for practice. I've been stuck in publications and journals, and I realized by the time that last I is dotted, it's already out of date.
Mhm.
And so for me, the best information source right now are people like you, Alexa. And my organization is Enhanced Recovery After Delivery. It's all in the name. That's just what we're trying to do. We're trying to enhance the experience that people have after they give birth. And we try to start early as the hospital stay, and even before they even come into the hospital. And so stories like yours, they're leading this effort. And I think it will change maternal health in the future.
All right. Well, thank you both so much. I think that this episode will honestly be heard from the mountains, because I know it's going to be shared and go viral. I know it will, because this is just a topic that has been just such a major theme of 2023, and I do think we're at sort of a precipice of improving maternal health in our country, which I'm really excited about. And I really do believe that cases like this will be history, and I hope sooner rather than later. So thank you both. Thanks everybody for listening. And if you are interested in reaching out to Dr. Seagraves, I will put her contact information and business information into the show notes. And everybody knows where to find me. So toodles. And that's a wrap. Thanks for listening. If you love our show, go ahead and subscribe to stay tuned for future episodes. As a thank you to our listeners, we're happy to offer $50 off of our Primary Care PT Foundations course or our Musculoskeletal Imaging certification. Visit us at redefinehealthed.com and use code PCPTPodcast, all one word, all lowercase, on the checkout page to claim your discount. That's PCPTPodcast, all one word, all lowercase. Until the next episode, stay awesome, y'all.